Dr. Farid Fata was a renowned oncologist in Michigan. He built a successful career and a reputation for compassion. Patients trusted him with their lives. Behind this facade of respectability, Fata harbored a dark secret. He was driven by greed, not the well-being of his patients. Fata's lavish lifestyle was funded by a horrific scheme. He systematically administered unnecessary chemotherapy to his patients. Many of them were not even diagnosed with cancer. Fata's actions were a betrayal of the most sacred oath in medicine. The patients, unaware of the truth, believed they were receiving life-saving treatment. They endured the debilitating side effects of chemotherapy, their bodies ravaged by powerful drugs they didn't need. Their suffering lined Fata's pockets, fueling his opulent lifestyle. The magnitude of Fata's deception is staggering. He treated hundreds of patients over several years. The financial cost of his fraud exceeded $17 million. The human cost, however, is immeasurable. Fata's fraudulent activities were as cold-blooded as they were calculated. He targeted vulnerable patients, often those already battling serious illnesses. He preyed on their fear and desperation, exploiting their trust for his own financial gain. He misdiagnosed patients to justify the chemotherapy treatments. He downplayed or ignored their concerns about side effects. Fata bullied nurses and staff who questioned his methods. He maintained a tight grip on patient records, making it difficult for anyone to uncover his scheme. One of Fata's victims, Robert Sobieray, received unnecessary chemotherapy and radiation for a misdiagnosed blood cancer. The treatments left him with lasting health problems, including teeth loss and body twitching. Sobieray, like many others, trusted Fata implicitly. He never imagined his doctor would deliberately cause him harm. Another victim, Patty Hester, was misdiagnosed with myelodysplastic syndrome. She endured unnecessary treatments that caused high blood pressure and hair loss. The experience shattered her faith in the medical profession. She lived in constant fear, questioning every medical decision thereafter. In 2014, Fata's reign of terror came to an end. He was arrested and charged with multiple counts of healthcare fraud, money laundering, and conspiracy. The evidence against him was overwhelming, built on years of deceit and the testimonies of his victims. Fata pleaded guilty to 13 counts of healthcare fraud and 1 count of conspiracy. He was sentenced to 45 years in prison, a sentence that reflects the gravity of his crimes. The judge, in handing down the sentence, called Fata's actions horrific and a stunning breach of trust. The impact of Fata's crimes on his victims is immeasurable. Many suffered long-term health problems as a result of the unnecessary treatments. Others died, their lives cut short by a doctor who swore to heal them. The emotional toll was equally devastating. Victims spoke of their anger, betrayal, and the loss of trust in the medical system. Now, more than a decade later, Fata is seeking compassionate release from prison. He cites health concerns, claiming he contracted a rare blood disorder and multiple infections after having COVID-19 in prison. He argues that his condition is deteriorating and that he is not receiving adequate medical care. His request has been met with outrage from his victims and their families. They argue that he has shown no remorse for his actions and that releasing him would be a grave injustice. The U.S. Attorney's Office plans to oppose his release, highlighting the severity of his crimes and the need for accountability. Angela Shukwit, the oncology nurse who bravely reported Fata's suspicious practices, remains a vocal advocate for his victims. She argues that Fata's release would be a betrayal of justice and a slap in the face to those whose lives he irrevocably damaged. The fight for justice continues, with Fata's victims determined to ensure he is held accountable for the devastation he wrought.